Hi, this is the continuation of a series of videos designed to give individuals information that they can use to prepare for a visit to a physician's office. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care is delivered. Do you know anybody who bumps themselves against something and ends up having a significant bruise on his or her skin? A bruise that doesn't seem to be justified by the minor contact with something such as a chair or countertop. Bruising is bleeding beneath the surface of the skin. It is not a common complaint seen by primary care physicians, but is seen enough to warrant a discussion. It would indicate a bleeding disorder, so it should be mentioned to your physician, and it should not be ignored. Your physician may refer to the bruising as purpura. Purpura, also called blood spots or skin hemorrhages, refers to purple-colored spots that are most recognizable on the skin. The spots may also appear on organs or mucous membranes, including the membranes on the inside of the mouth. Purpura does not blanch when pressure is applied. That simply means that it does not lose its coloration when pressure is applied, and the color returns when pressure is released. Large areas of purpura are called ecchymoses. Smaller areas are called petechia. Abnormally bleeding is usually a result of abnormalities in platelets, the coagulation mechanism, and problems with blood vessels. Platelets are tiny blood cells that help your body form clots to stop bleeding. If one of your blood vessels gets damaged, it sends out signals that are picked up by platelets. The platelets then rush to the site of damage and form a plug or clot to repair the damage. The coagulation mechanisms. Coagulation, also known as clotting, is the process by which blood changes from a liquid to a gel, forming a blood clot. It potentially results in hemostasis, which is the stopping of the blood loss from a damaged vessel. Coagulation mechanisms allow repair of the vessels to proceed. And problems with blood vessels. A defect in blood vessels that can affect each part of the blood system, such as capillaries, arteries, veins, lymphatics, or a combination of these. The defect usually occurs in the cells that line the interior surface of blood vessels and lymphatic vessels. Now, when taking a history, the physician will be interested in the patient's family history. Family history can possibly direct the physician to a diagnosis. The physician will want to determine if bleeding was spontaneous, if it has occurred before, if the bleeding has occurred at more than one location, if there was a recent trauma, if the patient has reoccurring nosebleeds, if the patient has had bleeding of the gums, if the patient has had blood in the urine, if there has been rectal bleeding, if there has been excessive menstrual bleeding. The physician will want to know what drugs the patient is on. A number of drugs, such as steroids and aspirin, can be contributing factors. Has the patient had any recent operations and procedures done? Any recent viral illnesses? Does the patient drink alcohol? And finally, if the patient has had recent weight loss, night sweats, or a prolonged fever. Naturally, the physical exam will initially focus on the skin. A general exam will be required. Signs of malignancy, lymphadenopathy, and splenomegaly must be looked for. The physician will order investigative tests. A complete blood count will be taken. The blood will also be placed on a slide and examined under a microscope or sent out for this type of examination. Initial testing will be contingent on the bleeding pattern. If a coagulation defect is suspected, a PT, an INR, and a PTT will be ordered. Your body makes several different clotting factors. A problem with any of them, if it's missing, broken, or there is just not enough of it, can affect how long it takes a clot to form, if it forms at all. A PT or prothrombin time looks at one set of these factors to see how well they're working. The partial thromboplastin time, or PTT, evaluates different coagulation factors than the PT does. The International Normalized Ratio, or INR, is a calculation based on the results of a PT. If a problem with platelets is suspected, a platelet count and skin bleeding time will be ordered. A normal platelet count ranges from 150,000 to 450,000 platelets per microliter of blood. Bleeding time is a test to assess platelet function. It involves making a patient bleed, then timing how long it takes for them to stop bleeding. If the physician is unsure of the cause, the physician will usually order all of the above tests. Initial testing may also point to the need of a bone marrow examination. A bone marrow examination is the analysis of samples of bone marrow obtained by bone marrow biopsy and bone marrow aspiration. Bone marrow examination is regarded as one of the most important diagnostic procedures to assess various bleeding disorders. We will continue our discussion in the next video. I hope this helps. Have a good day.